to Dr. Lauren Benishek. Lauren?
Hello everybody, it's my pleasure to be here with you today. I'm going to go over with you sort of an introduction to the Population Health Organization Assessment and our process for completing that. As I will mention again, it is a requirement to be able to attend the in-person part of our consortium in September. But let's begin with what it is. So what the PHOA is, it is a tool to assess your organization's readiness to manage the health of your population. And it does that by measuring multiple tactics, many tactics that are significant success factors for population health and that are nested under 6 domains. And these include organization and leadership, care delivery and management, physician integration and alignment, community health promotion, information technology and informatics, and of course patient and family involvement as well. So why would you complete this? So by completing it, it provides you with a roadmap that's appropriate for your organization to create a population health model that fits for your populations that you're serving. And it does so by pinpointing your organization's current strengths as well as opportunities for improvement. And this allows you to identify not only what you're doing well and celebrate that, but also then to focus on areas that are most important for moving your organization forward. And that allows you to use your resources effectively and apply them to the areas where they can do the most good. And so related to that, it of course then provides the insights that you need to create the strategies and approaches to support your population's health and build a strong culture of accountability for improvement. So related to this leading edge consortium, completing the PHOA for us will be done individually to begin with. We are going to be sending you an online survey link. This is going to provide a personalized web link to the PHOA, which is going to be hosted online. That is where you will be submitting your final survey responses that you do as an individual. Please do not forward or share that email or the link that it contains with anybody else. It is designed to be linked to you personally. However, if you would like additional people from your organization to participate in the survey, we're supportive of that. You'll contact me and I'll give you my information here at the end for more information on how to do that. You can ask up to 4 or 5 other organizational members to participate in the survey. But I would ask that should you choose to go that route, that at least for our purposes until after everybody's had an opportunity to complete and submit the PHOA, that you don't talk about your responses with each other. Okay, oops, I keep wanting to hit the wrong button. Okay, so just as a quick introduction, we have structured the PHOA across 2 types of response scales. The first is what I'll call the implementation scale, and this scale is for our more action-based items, and this scale ranges from no discussion has been done around this activity to there has been full implementation of this activity. And then we have a couple additional items that are more perceptions-based. They're a little bit more subjective, more based, they more get at knowledge and attitudes rather than behaviors or actions. And so your answers to these items are going to range from completely untrue to completely true. Now, all items will have a 6th response option, and that's going to be, I have not been able to get information about this item. I highly encourage you not to select that as the default should you not know offhand anything about that particular item or activity. Instead, I would highly encourage you to spend some time seeking out that information and looking for the people who would have more about that. So I recognize we're short on time, so we're almost at the end. If you do run across an item that has more than one component to it, you would choose the most relevant score. So as an example, if you have an item, if the item is services are provided by the organization through organization or through its partners, you would choose the score that's the lowest score relevant to either the partners or your organization itself. Please email me if any of that is confusing. So look for your email invitation to your survey link on January 19th, that is next Tuesday, and then your individual responses will be due by February 21st. That's going to give you about a month to complete the PHOA. I recommend that you go ahead and take a look at it early on. There are quite a number of items in there, so get familiar with it early. And as I said before, it is a requirement for the in-person workshop. Once you've completed the PHOA, make sure to submit your items through that personal link. Oops, okay. And again, don't forward your link. Here is my email address. Please feel free to email me if you have any questions or if you would like to look into adding additional team members to our PHOA survey mailing list so that they can complete it as well. That email address is le and then my last name, benishek @jhu.edu.